Well, okay, June gloom is starting to burn off. I came outside and I was like, oh, I can feel the heat. It's starting to come our way, but beware. Dr. Chaffoo is here to explain how the heat can actually make us act cold towards each other.
It really can, Shally. You know, what's amazing is they've done research and they found that the warmer the weather, we tend to for some reason, it may be the fact that as we've developed as humans, we tend to preserve our energy more, and so we're less sociable, we're more irritable.
We're in the
more
cold weather.
In the warmer weather, actually. In the warmer weather, because
okay.
we're trying to preserve our energy. So if you look at studies that are out there, they've seen that people tend to be less sociable, less communicative, less helpful the warmer the weather.
Okay, but I have a question, because when the weather warms up, you tend to want to go outside. You tend to want to have like a drink and go out to lunch and be around other people.
And part of that, we believe, researchers have shown that when we're in the sunlight, what happens is there's more of a production of vitamin D, and vitamin D is responsible for the creation of serotonin, which is an important, potent neurotransmitter that's responsible for mood elevation or improvement. You know, when it's cold outside, it's very gray and dreary. We have something called seasonal affective disorder. So we get kind of depressed and sad because we're not making that amount of serotonin. So if you turn the bright lights on or suddenly there's sun, we're going to feel much more hopeful, more optimistic, less depressed.
Look, I'm one of those people. If I had to choose between being hot or cold, I'd rather be cold because I get really not fun to be around when it gets really, really hot. And that's actually true, because it's more or less likely that people will not help other people when they're really hot.
Correct. Even with more humidity, we found changes in barometric pressure. You know, the lower the barometric pressure, unfortunately, the higher the suicide rate. So these are complex issues, but most likely, if it's a warmer climate, we tend to be even more aggressive. There's more horn blowing. You know, if you look at pitchers throwing baseballs, they're more likely to hit the batter when it's a warmer weather than when it's a little cooler weather.
When you're talking about warmer weather, like, is there a threshold? Where does the temperature go that people start to get a little?
So great question, but we don't know the answer to that. It's more in terms of relativity. So there was an interesting study done in Europe, and they looked at a group of people, and this group of people were taken to an area and told, look, there's going to be a survey done of a nonprofit organization regarding children in the underprivileged. Could you help with the survey? And so they divided them into two different rooms. In one room, the temperature was 5 degrees warmer than the other room. Now in the room where it's a bit cooler, about 95% of those people were helping with the survey.
Wow.
In the room 5 degrees warmer, only 65% of the people were interested in helping out with the survey.
Get ready, friends. It's going to get hot around here. Okay, I want to talk about one other thing, Dr. Chaffoo, before you go. There's a new frontier in cancer care. I heard about this yesterday, turning blood into living drugs. What is this?
It's remarkable and very fascinating, very preliminary results. You know, Shally, about 600,000 people a year die from cancer.
Oh, man.
So it's terrible. We're looking at the leukemias and lymphomas now, of which there are about 45,000 people, unfortunately, a year that pass away because they're refractory to treatment. You know, the tumor cells continue to change and evolve and mutate. So what researchers have found now is we can take blood samples and we can isolate what are called T cells. T cells are part of the immune system that attack cells, and we can modulate and modify those cells, re-inject those back into a patient with the receptors, and they can target these tumor cells. We've seen, again, very early preliminary results that we're seeing a drop of these tumor cells to almost indetectable levels.
And when does this come out to the market?
Probably later on this year. There are two centers, the University of Pennsylvania and also the National Cancer Institute, are those that are leading the charge. But it's very fascinating, very early preliminary, but these are for people that have no other treatments available. Immunotherapy is going to be the wave of the future for cancer treatments.
Well, hoping something works. Dr. Chaffoo, thank you for being here. Always good to be here with you. All right, don't get hot, Chrissy. Don't